We'll now move on to some therapeutic interventions, specifically electrical and manual. In the acute phase of interventions, in the electrical side of things, we can start with some electrical stimulation. Placing the pads here around the segment of pain that we're dealing with. She was L2 through L5 specific, so we can move these as needed, but this is a general setup. Initially, I'd want to start with TENS, transcutaneous electrical stimulation. It's a more superficial type of electrical stim that would just allow for pain relief and send those bloxam signals heading to the brain. This would be really good, as I mentioned, for pain relief at the beginning, and we could slowly progress that as the patient desired and as the patient was okay with to interferential current, IFC. That's a little bit of a deeper sensation, getting deeper tissues in the area, but also will help with pain relief. The manual intervention that I would like to do in the acute phase is some very superficial soft tissue mobilization. So this can look like in line with the fibers of such as the erector spinae, going vertical with that. Nothing too deep, as we just want to give a relaxation sensation to the patient. And we can also do some cross dragging up and down both sides. Again, this is very superficial, just helping with pain relief. Now, 5 days after our initial assessment, I would also like to include TENS, but I would like to highlight and focus on interferential current. Hopefully we've had some of that inflammation go down, some of that irritation go down, and we're in a different phase and ready for some deeper work. So interferential current will progress that to our neuromuscular electrical stimulation as well. So similar areas here, but stimulating some light contractions of our back muscles or our paraspinal muscles to aid with pain-free motion in that area. We'll also do some gentle joint mobilizations, such as anterior to posterior glides on the spinous processes and trying to grab the transverse processes and rocking back and forth. We can really rock that. Additionally, we'll continue with the soft tissue mobilization. And I did that very superficially before, but we'd get that a little bit deeper with the inline and the cross-dragging. Additionally, with that, myofascial release. And then one technique that we recently learned of the skin folding, of grabbing and going through the area. Maybe some working on fascial lines as well, going up and across the body. Those are some manual and electrical work for acute phase and 5 days after the initial assessment.